Welcome and thank you for joining us. My name is Kate Appelman. I'm the Senior Clinical Director for Men's Services here at Caron. And joined with me today is Jennifer Archett. Jennifer is our Clinical Supervisor for our Men's Opioid Program. And that's exactly what we're going to be talking about today. Opioid addiction and the opioid epidemic. You hear that phrase, opioid epidemic, everywhere, in the media, in social media, on the news, from our president, and in Congress. And part of the reason why we're talking about it is because of the glaring statistics that are realities for us today. 64,000 overdoses in 2016 alone. More overdose deaths in 1 year than motor vehicle accidents and homicide deaths. More overdose deaths than the AIDS epidemic at its height in the early 90s. This is something that we need to be talking about. And at this point, it's not just something in our country, and it's not just something in our communities. It's something that is under our roofs at this point. So I'm glad that you're spending a few minutes to talk to us about that. And when we think about opioids, there's so much, misunderstanding and misconception, and we need to start with the basics today so that we are all on the same page. Mm-hmm. So Jennifer, I appreciate you being here with us. And the first question is, when people say opioids, what are we talking about? Let's just start there.
Right, we're talking about heroin, and we're talking about prescription medications. So Percocet, Oxycontin, oxycodone, they're all opioids.
So prescription medications that are prescribed for wisdom teeth, surgery, acute pain. Right? So there's a place for that, as we all know. How do you know when that line is crossed from using it the way it's needed to be used, prescribed or not, the way it's needed to be used for acute pain, into something's changed and maybe this is a problem?
Right, so I'm gonna start abusing the medication if I'm taking pain medication after my acute pain is no longer an issue. So when we're seeking a feeling outside of pain relief, we have to start looking for signals and maybe being concerned at that point.
So at that point it stops becoming it's not about the pain anymore.
Right.
It's about that feeling. Can you talk a little bit more about that feeling?
That feeling, as patients describe it to me, is amazing. It's the best feeling in the world. So everybody reacts to pain medications and opioids differently. Some people are prescribed the medication and don't like the way it makes them feel, and they get rid of them and dispose of them and never use them again. For others, they're hooked. It's something, for whatever reason, that their mind has been looking for a really long time. They get the medication into their system, their brain says, this is what I've been looking for, and then their body becomes very physically addicted.
So they're in the position where internally they're hooked. There's that emotional and that mental hook, and we see it as craving and obsession, right? So someone who's struggling with addiction is going to feel that way. What about the other signs and symptoms? What would it look like outwardly or behaviorally to other people?
So there's going to be time lapses where there's a lot of time that maybe can't be explained. There's going to be moodiness. There might be change in sleep or perhaps too much sleep. You might see some signs of anxiety or depression, which can be a sign of when the patient is craving medications. They may seem very anxious or depressed. Isolating, avoiding, manipulating, lying. These are the addictive behaviors that aren't pleasant to be around.
Yeah, so what may start with acute pain and kind of move into, but I really like that feeling, right? And that hook and the obsession, that's all addiction, right? At that point, the choice is made, you're going to use. And behaviorally, you're just kind of putting things in place to keep it in place.
Correct.
Right? So you're in a position where someone is watching this and they're in a household with somebody who's struggling with this disease. What does intervention look like? What are some of the considerations that should be put into place?
I think it's going to be very important to seek professional guidance. I think in a situation like this, there's a lot of questions, there's a lot of unknowns, especially if it's never a situation no one's ever been in before, and I think assessment is going to be key. So reaching out to somebody in your community, in your area, that has a professional background in addiction that can help you and assess the situation.
So professional help, assessment, to help start treatment, right? So there's some treatment considerations that, and I, again, when I sit and Google opioid epidemic, there's a lot that comes up around statistics. There's a lot that comes up around treatment and MAT, and is treatment effective? Can you talk a little bit about treatment modalities that people might want to have in the back of their minds as they start this venture?
Right, so let's just say that you've seeked out assessment and treatments is now the word that we're using. So I think there's a multiple of variations of treatment, and I think it's very, very important for this epidemic specifically to talk about medical assisted treatment, or MAT, which is a combination of medical necessity, whether that is Suboxone or Vivitrol, some of the medications used for this disease, in addition to treatment and therapy. I think there's a lot to be said about the combination of both therapy and medical assisted treatment together.
Yeah, thank you for that. I think moving out of active addiction, I think it really starts with awareness. And if you think about the symptoms that we're talking about, if it's something that you see in your family member, if it's something that you experience yourself, having the courage to have the conversation is one of the key first points. And knowing, as Jennifer talks about, you don't have to go at it alone. There's people that specialize in this, in the assessment of it, in the intervention of it. Change is one of the hardest things that people go through, but it's one of the pieces that allows people to really grow and live the lives that they want to, which I think we all really deserve. So are there any other, if you can think of one or two other key points that you want people who are watching this segment to know, what would they be?
I think if you've watched this and you're questioning anything or anything kind of set with you, then to please reach out and ask for help and get some guidance. If there's some signs and symptoms that we have talked about with the moodiness and some of the depression, the anxiety, sleeping issues, irritability, please just ask. It's worth a phone call.
Thank you so much for being with us. For more information, please feel free to visit us at www.caron.org. Thank you for being with us. Thank you.
Yes.